Cerebral Venous Sinus Thrombosis, CVST. Have you ever heard of a silent type of stroke, one that doesn't start from a blocked artery, but from the veins inside your brain? Many people think only arterial strokes are dangerous, but the truth is there's another, quieter killer that forms slowly and silently every day: cerebral venous sinus thrombosis, or CVST. And the most frightening part? It can take your life, all because of what seems like an ordinary headache. Some people suffer from headaches for days, visit the doctor several times, and are told it's just lack of sleep or a bit of stress. Then one day, they suddenly collapse in the bathroom. Only then do doctors discover a blood clot blocking the venous pathways in the brain, preventing blood from draining out, raising intracranial pressure, and causing brain tissue damage. What if I told you that by recognizing just one small warning sign, you could save yourself or a loved one from this rare and deadly form of stroke? Would you believe it? And here's the most important part. This isn't your typical kind of stroke. Standard CT or MRI scans can sometimes miss it entirely. So why is this condition so dangerous? And why are older adults, especially women, more likely to develop it? Stay with me, because in the next few minutes, you'll learn how to recognize the early signs and how to stop it before it's too late. Cerebral venous sinus thrombosis, CVST, occurs when a blood clot forms inside the veins of the brain, blocking the flow of blood out of it. When blood becomes trapped, intracranial pressure builds up, leading to severe headaches, blurred vision, seizures, or even coma. Unlike arterial strokes, which strike suddenly, CVST can progress quietly, over days, weeks, or even months before it erupts. The danger lies in the fact that the early headaches often seem mild, causing many people to dismiss them. Have you been suffering from persistent headaches that don't seem to respond to medication? Have you ever wondered if that pain could actually be your brain sending you an early warning? What's especially concerning is that women over 50, particularly those who have used hormone therapy or birth control pills, are several times more likely to develop this condition. Why is that? And how can a normal MRI scan sometimes completely miss it? We'll dive deeper into that in just a moment, but before we do, please hit like to help spread this life-saving message to more people. And if you find this information valuable, subscribe so you don't miss upcoming videos on stroke prevention, healthy aging, and senior health tips. Leave a comment with 1 if you think this video is important, or 0 if you believe it doesn't concern you, though I bet by the end you might change your mind.
Because in the next part, you'll meet a 67-year-old woman from Florida, Mrs. Mary, who nearly lost her life because of one strange headache that lasted for 3 weeks. Mary, age 67, lives in Florida. She was always healthy, taking morning walks around her neighborhood with her little dog. But one day, she began feeling a dull pain in the back of her head. She thought it was just the heat or lack of sleep. Then 3 days passed, then a week. The headache didn't go away. It grew worse. Sometimes she felt dizzy, her vision blurred, as if she were seasick. At the clinic, the doctor told her it was just a tension headache and prescribed painkillers. But only 2 days later, she collapsed in her living room. When she was rushed to a major hospital, her MRI results came back normal, showing no signs of stroke. It wasn't until a neurologist grew suspicious and ordered an MRV, a magnetic resonance venogram, that they discovered a blood clot blocking her right venous sinus. If the doctor hadn't taken that one extra step, Mrs. Mary might have lost her life simply because of a misdiagnosis. Can you see how terrifying that is? Sometimes an unusual headache isn't just pain, it's your brain crying out for help. So what caused that blood clot to form inside Mary's brain? And more importantly, how can you tell when a headache is just ordinary fatigue and when it's something far more dangerous? Under normal circumstances, after nourishing the brain, blood flows back to the heart through a network of veins. But when one of those veins becomes blocked, the blood has nowhere to go, causing pressure to build up inside the skull. That pressure begins to squeeze brain cells, depriving them of oxygen until they start to die. And that's when stroke-like symptoms appear: confusion, slurred speech, weakness on one side of the body, even seizures. The alarming truth is that standard CT or MRI scans are designed to look at arteries, not veins. That's why so many cases of CVST slip through unnoticed in the early stages. Only a magnetic resonance venogram, an MRV, a specialized imaging test, can reveal the venous sinuses and expose the hidden clot. Do you see how one small difference in diagnostic method can completely change the outcome of a life? How many people might be walking around today with a mystery headache, not realizing there's a ticking bomb in their brain? Cerebral venous sinus thrombosis can happen to anyone, but older adults, especially women, face higher risks. The causes vary: genetic clotting disorders, chronic diseases, hormone therapy, or infections. Some people with cancer or those confined to bed after surgery are particularly vulnerable.
What makes CVST even more dangerous is its slow, silent progression. Many people continue their daily routines, unaware that blood flow inside their brain is becoming increasingly obstructed. Have you ever felt your head feel heavy, your vision blur, your balance falter, or your focus fade, for no clear reason? Could that be your brain's early warning sign, one that's easy to ignore until it's too late? And if you discover that you or someone you love might be at risk, what's the right course of action? Should you take aspirin or anticoagulants on your own? These are crucial questions, and the next part holds the answers. The good news is that if CVST is detected early, most patients can recover completely. The first line of treatment is anticoagulant therapy, typically heparin, which prevents the clot from growing and allows the body to gradually dissolve it. For those with inherited clotting disorders, doctors may prescribe warfarin for long-term management. In severe cases, when medication alone isn't enough, doctors can perform a catheter-based intervention, guiding a thin tube into the blocked vein to deliver medication or physically break up the clot. It may sound daunting, but this very procedure has saved thousands of lives, people who, not long ago, would have had no chance at all. And here's the truly miraculous part. About 3 out of 4 patients who receive proper treatment for CVST can go on to live completely normal lives again. Mrs. Mary, the 67-year-old woman from Florida, is one of them. Just 4 months after her recovery, she's back to walking her little dog every morning, smiling as she tells me, "It feels like I've been given a second chance at life." But the real question is, how can you or someone you love make sure you never have to go through something like that? How can you recognize the kind of headache that's not just ordinary pain, but a red alert from your brain before it's too late? You see, aging itself isn't what's frightening. What's truly dangerous is not understanding your own body. Many people could have avoided tragedy simply by recognizing the signs earlier and asking the right questions. Cerebral venous sinus thrombosis isn't a death sentence, not if you listen to your body and act in time. A headache that feels different, blurred vision, dizziness, or even mild seizures, don't ignore them. Go to the hospital and ask your doctor specifically about an MRV scan. Sometimes one simple question can be the difference between life and death. Do you believe that one timely decision today could give you decades more of healthy, joyful life with your children and grandchildren? Because that's exactly what awareness can do. If this video has helped you better understand the hidden risks of venous stroke, please click like to help share this knowledge with others. And don't forget to subscribe for more videos on senior health tips, stroke prevention, healthy aging, and doctor-recommended advice designed especially for older adults.
Leave a comment with "I care" if you believe that taking care of your brain health is the true key to a long and happy life. And remember, never underestimate a headache. It might just be your heart and your brain trying to tell you something important, something you need to hear right now.